I'll be introducing the speaker here for today. Leela Steiner is an environmental health and knowledge translation scientist at the National Collaboration Center for Environmental Health, and she is also currently a Bridge Fellow at UBC School of Population and Public Health. Her recent research has included work on endocrine disrupting compounds, food contact materials, and regulatory frameworks for emerging contaminants. Please welcome.
Hi. Thanks everybody for having me here today. I am going to have to get used to this echo in my ear for a couple minutes, but hopefully you'll be able to all hear me perfectly fine. As I just mentioned, I do work for the National Collaborating Center for Environmental Health, and today what we're going to talk about is personal cannabis cultivation and the health and safety concerns that come along with that. So just to give you a little background, if you don't know anything about us, we're one of 6 national collaborating centers in the country. We were formed in 2005 by the Public Health Agency Canada, and basically that's to promote the use of knowledge and evidence by public health and create some capacity in different public health spheres. So I've put the 6 up here, and those 6 are methods and tools, Aboriginal health, infectious diseases, healthy public policy, and determinants of health, and we are the environmental health component of that. I'm sure you've all heard a little bit about knowledge translation at some point, but just to clarify what it is that we do, it's kind of in these 3 spheres. The first is that we synthesize and exchange knowledge, which kind of means that we gather and incorporate evidence from both research and practice and put it into an information package kind of in a way that's useful for different stakeholders. So those stakeholders include medical officers of health, environmental health officers, public health inspectors, anybody who really needs to get a sense of the evidence on a particular topic and what they should be doing about it, what the risks are, what's most important for them. We also try to identify knowledge gaps, so what actual research and policy needs to be made in a particular topic area. And then we try to build capacity by connecting people. So that means different partners around the country that are working on similar projects, that might have a similar interest in their communities. We kind of play that broker role in a way, in addition to giving people the science that they need to make the decisions that they need to make. I'm kind of being cut off at the bottom here, but hopefully that won't affect the rest of the slides. But I do want to say up front that I have no financial interest in the cannabis industry, which is kind of an important thing to say, because you might hear a lot of talks about cannabis and risks and all the things that are happening right now with legalization, and a lot of those talks are going to come from industry, even though they might be disguised as something else. So just pay that in mind when you're listening to all sorts of different cannabis talks that come up. So what I'm going to talk about today is personal cultivation, and the way that came about for our organization was actually because there were a number of high-profile explosions, and fire departments came to us and said, how are we supposed to deal with these fires? Are they unique from different fires? What are the risks going into those environments? So that kind of led us to develop a couple of framing questions for this project, and I've put them up here for you to read. And broadly, they include what environmental health hazards are associated with cannabis cultivation, processing, and use as a whole. How is legalization actually going to affect the extent, scale, and conditions under which people are cultivating cannabis, both at home and in commercial settings? And then what measures can we actually implement to reduce the exposures and the risk through all phases of this production cycle? So we kind of built off of that inquiry that we got to kind of identify what I was talking about in our knowledge translation side, which is what needs are there out there in an occupational setting and in a personal setting to help us deal with some of these risks. The scope for this project, the cultivation project, has kind of been narrowed down to these 5 environmental health risks, and that's what I'm going to talk about today. So the first is access and accidental poisoning. The second is indoor air quality. Third is pesticides, electrical and fire risks, and then radiation hazards. As we go along, I'm also going to talk a little bit about the policy considerations for each of these risks, and then at the end we're going to spend a few minutes talking about risk communication as concerns cultivation, but also about cannabis more broadly. I am going to encourage you, for the people who are in the room with me right now, to you can put up your hand at any time to ask a question. It's great when you think about things right on your feet. There are going to be questions that come up for you, so feel free to interrupt me, and I'll just repeat them into the mic for the people that are listening online, all right? So please feel free to put up your hand at any moment. What I'm not going to talk about is the actual health effects of consuming the plant, okay? If you are interested in the health effects, there's a fantastic document out there. It's from the National Academies of Sciences, Engineering, and Medicine. It uses a strength of evidence approach, which is fantastic. It really balances things about what we do know, what we don't know, what we're not really certain about. So that might be a great guide if you are interested in the subject matter. And it does kind of help us present some of this information without the hysteria that often comes along when we're talking about drugs. So it's a really balanced read, so I do highly recommend it if you're interested. So let's give a little context here for this issue. Why are we all talking about cannabis? Why is this coming up? All right. There are commercial operations in Canada already, 67 licensed producers for medical growing. They are subject to inspection and testing, but as I'm sure you can imagine, that's not consistent. It is sporadic, and it's also not something that has given us as much information as we need about the risks that are happening right now. As I'm sure you also know, under the law that was just passed, each household is allowed to grow 4 budding plants. So if you don't know what 4 budding plants looks like, a fully grown mature plant is a bit taller than me. So that's a lot of plant material when you think about it in somebody's house. We don't also have any idea of how we're going to regulate that kind of a limit that's been imposed, okay? So we don't have the capacity to send people into everybody's home to say, do you have the exact right plant limits? That's just not reasonable and logistically quite impossible. From the states, we do know that there's nothing to suggest that illegal grow-ops are going away from the states that have legalized, I mean to say. And at the moment, there's actually not very much guidance on how to grow properly at all. So people are just kind of gathering their information willy-nilly from all over the internet and growing forums, and that's not the best way to reduce risks because those forums are really talking about how to get the most out of your plant, right? Totally different ballgame. So let's turn to the first environmental health risk that I mentioned in our scope here, and that is access and accidental poisoning. So as a note, though this has just recently been changed in BC, at the federal level, there's actually not going to be an in-home possession limit for how much plant material you can have in your home. So if you wanted to go out and buy 30 grams each day, you could accumulate really large amounts in your house, right? I think in BC they're just amending and they're evolving as we go, so I think it's now 1,000 grams as a limit in your home, but that's still quite a lot for personal consumption, so you can see how that can build up over time really, really quickly, right? We do know that just having that amount around just increases the risk of access, right? When you just have a lot, it's really, really easy for somebody to just stumble upon it, to get access for a child, for a pet to come into contact with it. So the combination of this lack of limit and then the fact that you can just keep as much in your home, that's a problem for access. Some of the information that we have about this is coming from the poison control centers in the States. So actually they've been looking at poisonings from children since legalization, and what's fantastic about that information is it really tells us where the risks are and where they're not. So does anybody know what this is on the slide right here? Shout it out. Go ahead, over here. It's hashish, right? Anybody think they thought it was something else? Chocolate, yeah. Definitely looks appealing as a chocolate edible product, right? It's definitely resin, okay? The Poison Control Center data in the States is telling us that actually children and pets are just as likely to consume something that is a waste product than they are an edible product. There's a couple of reasons for this. One, these kinds of waste products and other consumables, joints, buds, leaves, anything you're leaving around, children don't care. They put everything in their mouths, right? They're not really paying attention to that. Second, adults tend to be much more diligent about storing edibles. They know that it's appealing to children. They know that candies and cookies are something that they're going to grab off the floor if they're left on the floor or off the coffee table. Excuse me. And so they put them in cupboards and they put them in the right storage containers. They put labels on them and they're like, you know what, we're going to be safe about this. But if I leave my half-consumed joint on the coffee table, no kid's going to eat that. So that's actually information that's come out of the poison control centers that we didn't expect to find. So that's a part of accidental poisoning that we really do have to consider, and that we have to encourage people to treat all of these different products with concern because they all pose a risk. This is Kellen. Kellen ate an entire cannabis cookie 3 days after our paper was published on this. He ate the cookie, he ate the wrapper, he ate the bag it was in. We didn't know he had eaten this cookie until 8 hours later because he ate all of the evidence that came with it, okay? That's an issue, right? People don't think about the fact that these are accessible things. They're not often kept in lock boxes. Don't worry, Kellen's fine. This is just his always dopey looking face. But it was a concern. We didn't know, P.S. this is my dog, in case you were confused. And he went to a friend's house overnight because she was gonna take him hiking. Her roommate left a cookie on the coffee table. She didn't know this had happened until she came back from her hike with him. She dropped him off and we're like, he was kind of acting weird all day, we don't know. I was actually terrified of having to call the poison control center and disguise my voice. But thankfully I didn't have to do that and he survived. But this is a really common occurrence. A cookie contains 6 doses on average for an adult human. He weighs 25 pounds, right? That is a huge problem if we're not paying attention to the dose in these edible products and we're not paying attention to how we store them, okay? All right. So some considerations for access and poisoning. What can we actually do about that? First, we do really need to promote those safe practices, right? We want people to know how they can store their products, what they should be doing with them, the fact that all of these different things are appealing to everybody. A second point is that we really need to support these poison control centers, okay? They actually act as a fantastic resource for immediate and anonymous advice and have been used kind of consistently also for emergency room physicians and nurses because many of those professionals haven't seen cannabis poisonings in their careers necessarily, and so being able to call the Poison Control Center is really, really important. So we do need to support them because it's the first best place to get information on poisonings that are happening. We can also possibly use the poison control centers for surveillance. So I'm not sure if you're aware, but actually emergency rooms are required to report opioid intoxication. And maybe we can use that poison control center as a resource for emergency centers to report those kinds of intoxications and get a little bit more data coming out after legalization, right? We can actually find out what's happening a little bit more if we encourage people to just report it, even if there's not information that they need immediately. We also want to encourage people to dispose of the waste properly once they've been growing these plants at home. So what I mean by that is you see this container at the bottom of the screen. It has lots of the leafy products. Most people don't use that to smoke. It can be used for other things, which I'll get to later, but at the end of the day, we might have buckets of this stuff flying around if you've got a plant that's huge and you've got 4 of them. Right now, Health Canada recommends putting it in a blender with water, mixing it with kitty litter, and putting it in the trash. Vancouver's not really into that kind of waste disposal. I'm sure that you're aware of how intense the bylaws are about what you're putting in your different waste streams, right? But we actually haven't made any provisions for that on a municipal level yet. And that's something that we really need to keep in mind because if there aren't any guidelines on how people are going to dispose of it, they're going to dispose of it in whatever way is convenient for them, which isn't necessarily going to be great in terms of people having access to that product, right? Okay. Let's switch to the next environmental health risk. Indoor air quality, which is something I'm sure you all study all the time in your work here. And the first part of indoor air quality that I want to talk about is humidity and mold. So why is this an issue for cannabis plants? Well, one, they actually need really large high levels of humidity to actually establish themselves. So the young seedlings, the roots, they can't establish themselves unless they're experiencing 70% humidity in their growing environment to begin with. And then once they have established themselves, the plants actually produce incredibly high levels of humidity. So one cannabis plant, a fully mature cannabis plant, produces the equivalent of about 7 tropical plants worth of humidity. So if you think about that in terms of 4 plants, you've all of a sudden got 28 tropical plants worth of humidity in your little grow space, okay? That's a problem for 2 reasons. One is that it tends to encourage fungus and mold growth on the plant itself that we might then consume. But it actually encourages mold growth in the home as well. High levels of humidity are problematic for both of those issues. And they are exacerbated in Canada. Can we think of why that might be a bigger problem in Canada? Anybody? Long winters? Yeah. We seal our homes in here, right? We are trying to keep the heat in, which also keeps the moisture in. So actually moisture issues in Canadian homes are already problematic. And so when we add in this kind of added moisture pressure, it's certainly an issue to think about. The second indoor air quality issue that we often hear problems around is odors. So odors actually come from a whole bunch of different compounds within the flower. It's kind of this resiny, secretious area of the plant. It varies pretty dramatically between the species and the hybrid. So obviously the smell is subjectively better or worse depending on the person. There's not actually much evidence to suggest that the odor itself is detrimental to human health, so do balance that when you're thinking about it. But it has been argued that odor can impact well-being in terms of annoyance and stress, right? So for instance, I'm going to give you an example. I'm not sure if you're familiar, but there's a town in Ontario that used to be where the Heinz factory existed. It's Leamington, Ontario. So that whole town was just tomato plants. But then the Heinz factory closed down a couple years ago and they converted all of those greenhouses to cannabis greenhouses. So that entire town in southwestern Ontario now smells like cannabis for miles around. Like this is hundreds and hundreds and hundreds of acres. despite the fact that there's no evidence that it actually affects your health, that's certainly been an issue for the townspeople in terms of annoyance and stress, right? If you are interested in odor, which a lot of people are, Public Health Ontario actually released a fairly comprehensive evidence review about odor and health effects, so I would encourage you to check that out if that's an issue that you're keen on. The last indoor air quality issue that I want to talk about is carbon monoxide. So CO2 enrichment, as I'm sure you all know, because I'm sure there are lots of gardeners in the crowd here today, actually promotes plant growth, right? It increases yield. So people actually use CO2 to pump into it, they pump that into their grow rooms to make their plants grow better. This is a problem because there's a byproduct of CO2, and that's carbon monoxide. And the way that people are pumping it into their homes is not often the brightest. They sometimes use CO2 generators or burners. They sometimes vent their furnaces or water heaters directly into the grow space. I think you can imagine why that's problematic for carbon monoxide. So we definitely want to pay attention to that as an issue, especially since, once again, Canadian homes are sealed, and so that becomes a problem very, very quickly. Yeah, go ahead. So the question that I just got from the audience is, have there been any incidents related to CO? I'm assuming you mean related to emergency hospitalizations from CO. Not in personal settings because it's so newly legalized that hasn't been reported in Canada. It certainly has been reported in the States in commercial facilities because those are intentionally pumping in very, very large volumes of CO2. Unfortunately, we don't have the data yet in Canada, so that's the one problem with this, is that we really do need legalization to get some of that information, right? Okay, so policy considerations. How do we reduce some of these indoor air quality issues? First, we can limit the plant numbers. Obviously, all the things I just talked about are related to scale, okay? So the more plants we have, the more issues we're gonna have with mold, the more issues we're gonna have with odor, the more issues we're gonna have with carbon monoxide, right? Again, we can't enforce that plant limit. So even though we can encourage people, it's not going to get rid of all the issues on their own. It's just going to help to mitigate some of those issues. Second, I think you can all imagine that growing outside of the home would get rid of this, right? You're not going to accumulate mold in your basement if you're growing in your backyard. You're not going to accumulate CO in a confined space if you're doing something on your front porch. However, most of the provinces have decided not to allow outdoor growing. This is partly because they're concerned about theft and access issues. So if people actually see your plants, they're more likely to come take them. And so because a lot of this legislation is built around protecting youth, that it has been something that has been tabled by a lot of provinces. The Yukon is one of those places where you can grow outside because they've said, go ahead, it's safer. And they're kind of balancing those risks and saying that that's a bigger issue to them than access. But all the provinces are kind of making their own decisions about this. So it's certainly something to consider. I will also say that in BC, just so you know what's going on here, they have decided that you can't grow anywhere where the public can see. So that basically means you can't actually even grow on a windowsill that's visible to the outdoors. So if you were growing in, say, a non-attached structure in your backyard that had no windows, that would be okay. But if anybody can see these plants, then that kind of counts as exacerbating theft and access issues, right? So you can see how the laws will change pretty dramatically depending on the jurisdiction. And it's certainly something that I think all the provinces will begin to get lessons from as we go forward. And finally, obviously, we want to discourage the use of those ignition devices, those CO2 burners. We just want to encourage people to not use them at all because it's really a terrible idea. So our third issue, pest management. As with all of other types of gardeners, cannabis gardeners and farmers and cultivators experience pests. They experience aphids and mites and common insects like spiders, all those types of things. The problem is that because these plants are grown in particular conditions, if a pest shows up, it's actually very detrimental to the crop. If you think about these huge big plants inside, actually, you know what, I'm gonna just go back for a second to show you. Those are seedlings and those are fully mature plants on the slide, so you can compare what people are starting with and then what they realize what they're getting, right? It's a big change. So if you think you're starting small and that's gonna be fine, it actually turns out to be cornfield size plants, so it's something to consider. So there is a strong incentive to use potent pesticide options when you're in a space that's enclosed. There's a lot of plant material and a pest showing up can wipe out a crop really quickly. The second issue, which is partly relevant in Canada but partly not, is that in the States, it's federally prohibited, which means that there are actually no EPA-registered pesticides. The formal evaluations are not getting done, which is really problematic because it means there's no guidance on what pesticides actually might be appropriate for use in this context. In Canada, it's a little bit different. We do have Health Canada, the Pest Management Regulatory Agency, which have registered 20 pesticides for use on medicinal cannabis, but most of those pesticides are very mild. So they're oils, they're salts, detergents, biologicals, that kind of thing, and overuse of them is actually not detrimental to people's health. But the problem is that because they're very mild, people are still likely to use more potent options if they do have a sudden outbreak. So you can use them kind of in a proactive way, but if something comes along, it's very, very common for people to reach for those synthetics. Oh, my slides. Some policy considerations for pesticides. Again, growing outside, right? When you don't have those chemicals in your home, you're less likely to come into contact with them. But as I mentioned, that's not an option in all of the provinces. We do need to identify and promote low-risk products, which means that we do have to have those evaluations done on some synthetics. We have to have them out there available for people with actual educational materials that will help people make the right decision for their situation. And developing cannabis-specific pesticide guidance is a big one because right now people might not be reaching for the chemicals that are kind of illegal but that they can get in the States, but they might be reaching for a pesticide that's really not appropriate for the plant. So for instance, a lot of people use pesticides on their strawberry plants because they're very susceptible to pests. But when you consume a pesticide, it's very different than when you inhale it, for instance. So how those chemicals interact is really important in terms of choosing the right one. And because it only just became legal, that process is underway, right? We don't actually have a ton of guidance, and that's pretty critical to reducing some of these risks. Okay, let's move to electrical and fire hazards. This is often related to improperly used or installed equipment and or people tampering with the electrical supply. And by that I mean they install larger circuit breakers to avoid some power interruptions, or they might actually mess with the home wiring itself, just because there are large energy demands for growing these plants successfully. I mean, you can see on the slide here that we have a little bit of an octopus situation, but that's kind of the best case scenario. I'm sure everybody has that in their office behind their computer as well, so it doesn't look super risky, but when you add that to 10 more of them to keep those lamps going, that's a bit of an issue. I will also say that the glow lamps that are used are often incredibly high burning heat lamps, so that in itself creates a bit of a fire risk. The overloads as a result of using all this equipment is an issue, and then to compound matters during an actual fire, getting out is a problem. You have a lot of dried plant material, you're keeping pesticides around, so you have chemicals in the space. You might be using a CO2 burner to pump CO2 into your room, and then you also have electrical issues to add on top of that. It's much, much harder for people to get out, and it's actually much more dangerous for first responders to actually get in and rescue you. So not only are the risks of electrical and fire hazards increased, but your chances of getting out in one piece are pretty bad as well. Now, there's another part of the electrical and fire risk story that's becoming more and more problematic, and that's the processing of cannabis. So you might have seen in the news a bunch of stories about explosions. Actually, one happened in Ontario in Whitby 2 weeks ago, like a week or two after legalization, and 3 people were in the house at the time. And it blew the side of the house clean off. And that happens when people try to process those waste products. So what you can actually do is you can take the cannabis leaves and put them in a tube and compress them and use a solvent like butane to blast them, to use pressure and blast through that product to get kind of this golden residue at the end. And then you burn off the solvent that you used in a high pressure, high heat situation. So I think you can all imagine how that's a really bad thing to try to do in your kitchen, but people do it, and there's a reason. There's a couple of reasons, actually. Those kinds of concentrates actually have THC levels that can get up to 90%, so it's a very, very strong product. It's also really cheap to make, right? You can use all the waste products that you can't smoke, that you can't turn into edibles to make this other product. So this kind of goes back to what I was saying about waste. If we don't have a good way or guidance distributed to people about how to actually get rid of their plant materials, they're going to use every single piece of it because they want to get the most out of their growing experience, right? So we do have to think about all of these different issues. I will also say that concentrates, I have been told, create a very different high sensation. So even though we might decide to provide guidance on how to reduce your risks here, people are still going to want that product. So if they're not allowed to make it, they're going to want to search it out somewhere else, or they're going to want to make it illegally. So we kind of have to think about all of those different issues when it comes to explosions. And this is not a chronic issue the same way mold is, but it's obviously an acute, like high-risk issue when it does happen. If you think it hasn't happened, in Colorado and California, the states that banned the sale of these concentrates, they had over 100 explosions each in the first year of legalization. BC and Ontario, even before legalization, have had 30 explosions each over the last 5 years. So again, not wildly frequent, but certainly a risk, and certainly a risk to the people around them, right? Like this, people who just had this explosion in Whitby had 3 units in this house, and they were the unit in the basement, but 3 other people's homes were destroyed in the process, right? So it is certainly something to think about. Okay, so what kind of policy considerations are there for reducing some of these fire hazards? One, we can try to regulate the sale of equipment using municipal electrical fire codes, building codes, that kind of thing, for the way that people install their hydroponic systems. We can try to come up with situations that can help with that. But at the end of the day, most of the things that people use, you can buy at Canadian Tire, right? They're not actually hard to find, and they're used for perfectly legitimate other reasons. Like CO2 generators are used in all sorts of agricultural greenhouses. It's not actually hard to buy butane. Like I have several canisters of butane in my house for camping right now, right? It's actually very, very difficult to control some of these things because you don't have to buy anything really sneaky. It's very easy to get your hands on it. Second, we can just generally encourage people to use lower risk equipment. That means using an LED lighting system, which has actually been found to promote plant growth just as much as those high wattage super hot lamps, and they're not nearly as dangerous in terms of fire hazard, right? Regarding hash oil production, it's a little bit trickier because, as I said, they're super strong products, but some of the states have taken different approaches. In Washington state, they've decided to just allow the sale of concentrates, so you can just go buy them. And if somebody were to say to me, you can try to do this in your house and possibly risk your house exploding or buy it, I think that's the obvious choice, even if it means wasting some of your plant material. But those products do come with a much higher risk in terms of consumption. So the other states are just putting an insanely high fine on actually doing that kind of production in your house. So California and Colorado's fines are somewhere around $950,000 or something if you're caught processing cannabis to make this kinds of oils in your home. So they've gone in different directions. It's really hard to say which is more effective. In Washington, they haven't had any explosions at all, but at the same time, it means having a much stronger, potent product on the market, which still could carry risks because we don't know enough about these products at this point. So it's a balance, right? We do have to consider both of these sides. The last risk, radiation hazards, all right? UV, it sounds really simple, but this is a real thing, right? You have these huge grow lamps. If you're spending a lot of time in there, that's a lot of UV exposure. Unfortunately, the information that we have on that is coming from commercial settings at this point because we don't have enough data on what's happening in people's homes. But there have been a bunch of studies on the workers in those commercial settings. And one study found that a worker who was there for 8 hours actually would exceed the UV limit by about 9-fold, and that's in one day. So it's not a small concern. It's certainly something to think about, especially when it comes to choosing alternative lighting options. So I've put an image up here on the screen. You can see a worker in a commercial facility. He's wearing a hairnet, sunglasses, long sleeves, but his head and his neck are still obviously quite exposed to the lights. And incidentally, the hairnet and the sleeves are not to protect him at all. They're to protect the flower. Because the sticky flower that I'm talking about actually picks up human hair and skin very easily. So the only thing here that's to protect him are the sunglasses. So we obviously have to think a little bit harder about what we're providing to the workers or requiring that workers wear to kind of get rid of some of these radiation hazards. So policy considerations for this are a little tricky because, again, you can buy UV lights everywhere, right? People can take them home, they can mess with the filters, they can take them out and have way more UVC coming out, which is helpful for the plant, but it also increases your exposure quite a lot. So all we can really do is encourage people to obey the manufacturer's instructions, because we're obviously not banning the sale of lights anytime soon. So we just have to be really on the ball about education, because it's something that is not going to be reasonable to regulate in people's homes. So we've covered our 5 environmental health risks. How do we get those messages out? Part of this paper was developing a table with public risk messages that focus on each of these risks, and it's quite small here, so I'm actually just going to skip to the next slide where I just focus on the indoor air quality risk, because I just chose that one. The point is that it's actually super important to have a consistent messaging scheme, right? We actually have to be on the same page across the country, across these different jurisdictions, about what we're telling people that they should be doing to reduce some of their risks from these potential hazards, okay? So the indoor air quality risk messages, just as an example, it came from that table. One is we want to encourage people to scale production according to the ventilation capacity of the room. So if you know you don't have a lot of ventilation, like maybe don't grow all 4 plants, maybe just try 1 plant. If you have asthmatics in the house, people who are particularly sensitive to mold, pay attention to that. And see if you actually are able to control odors. Some people do use filters for that. They haven't been super effective at controlling spores or mold, but obviously they are used in commercial facilities to kind of keep the odor under control. We do also want to encourage people to control humidity. This is a big one. You have to be able to assess and reduce moisture sources. You want to restrict your cultivation to a humidity controlled room. And you can use a dehumidifier to help with that process, right? So these are simple messages that we want to send out to people. Be vigilant for signs of dampness, consult professionals if you need to, because at the end of the day, now that it's legal, there should hopefully be slightly less stigma around consulting professionals. And if we encourage people to do that and make it clear that these groups are there to help you, that will help at the end of the day as well. We do want people to know that they should get rid of any infested plants as quickly as possible, which means providing them an option to do so, right? It means talking to municipalities about how they want those kinds of plants disposed and having a plan for it before people run out of options and do it a way that we really don't want them to. Don't use ignition devices. I wish it were more subtle than that, but it's not. It's a very straightforward message. Please stay away from those kinds of devices. And then we can encourage people to just equip their homes with a CO2 or CO monitor. Carbon monoxide monitors are really easy to get, so it's something that we could jump on really quickly. So what are the challenges generally with cannabis risk messaging? Not just personal cultivation, but when we start this conversation, people have questions about all sorts of different things. So cultivation comes into it, but we do have to think about the overall picture, because everybody in this room is thinking about a different cannabis issue at the moment. We can't keep people focused just on cultivation. So how does public health actually craft these messages? We do want to be really fair about the risks, right? We want to let people know what we know and what we don't know. We want to encourage people to reduce their harms rather than abstain, because they're clearly not going to. And we do want to move away from some of the stereotypes, fear and stigma that we've used in the past in public health. I think a lot of the conversation has actually moved to this motto called normalize conversation, not consumption. And that's kind of a good frame of reference when you're talking about cannabis, is you want to make it very reasonable to talk about. It doesn't have to be like a giggly kind of conversation. It can be something that you talk about kind of casually, but that's what we're going for, right? Is some situation where people feel comfortable having those conversations and it's not a big deal. Part of this is returning to some of the basics. Risk communication has often come out of emergency situations, so floods, wildfires, that kind of thing. And that motto for them is be first, be right, and be credible, right? So we want to be able to talk about cannabis in a way that we're not the last people to get to the conversation. We don't want people to be getting their information from grow-up supply stores or from cannabis industry people. We want to actually be on the scene. We want to be proactive about the work that we're doing so that we can be first when the public has questions. We don't want to overstate the risks. We do want to be right about what we're telling people. And being credible is partly about not trying to promote a particular agenda, right? It's making people trust what you're saying. We want to use plain, appropriate language and target the right audience for the information we're giving. So for instance, if we're trying to reduce some of the risks around home cultivation, we're not necessarily going to go reach out to a high school and say, can we give a demo on home cultivation, right? We're going to try to talk to neighborhood groups, or we're going to try to talk to home hardware about the kinds of pamphlets that they're handing out. If we want to talk to youth about the harms of overuse, then that's the messaging we need to give to them, right? So targeting those different groups is really important and not confusing those signals. At this point, we really do have to understand the limits of the evidence, right? We have incomplete information at this point. Legalization is greatly going to facilitate this, but in the past, as I'm sure you know, public health has been pretty consistently accused of reefer hysteria, right? Of kind of building up these harms that are oftentimes overblown. So we do have to be realistic about what those are, because that is exactly how we lose credibility. What do we know that we can actually communicate about cannabis? There's four big things here, right? We're very certain about this. Inhaling particulates of any kind, no matter what you're smoking, is not great for you, right? I think that message has been really well hammered home by public health, and we can stick to that, right? There's no risk of coming across as overblowing the risks if we're focusing on that message. We do know that if you're storing your products carelessly, that can lead to poisonings. There's not really much contention around that issue. Driving while impaired with any substance is dangerous. And we know that there are smart and not smart ways to grow cannabis at home. So overall, what can we do to reduce these risks? What are the takeaways? Just to build on what I was saying about credibility, I do need to emphasize a couple things. One, there's a few issues here that are going to make these risks either big or large, and it's extent, scale, and persistence. So that means how many people are going to grow, how big are those grows going to get, and how many people are going to stick with it, right? What that basically means is, are all of these things going to happen? Is it just going to be my parents who grow a plant beside their raspberry canes in the backyard and chuckle to their friends? Like, is that going to be the extent of the issue? We just don't know, right? We don't know if it's going to be overblown, or we don't know if it's going to be not enough. So just paying attention to that, getting that information from the poison control centers is going to be essential. Which is the second point here, is we do need surveillance, right? We do need to find a way to get that information quickly as it's happening, as legalization debate evolves, as edibles come into play. We need to have a good idea of what's going on and where the issues are. We also want to think about different and unique ways to communicate to people. We can't just have education campaigns, though that is obviously incredibly important. It needs to be practical. So one of the Hello? Mic is good? Really? Are you sure? All right. So what I was saying is that when we're talking about novel ways to communicate with people, maybe it's something to do with being practical. So one of the ideas that's been floated has been the development of cannabis safety kits. So what that might mean is you go to City Hall or you go to Home Depot, and if you're saying you want to grow cannabis, here's your kit. What does that kit come with? It comes with a locked storage box for all your products. It comes with labels for your products. Maybe it comes with a CO detector. Maybe it comes with instructions with how to use different pesticides, right? So if we actually provide these types of things in a manner that is convenient, we might get that messaging out without having to bombard people with advertisements. It might just be something that you can readily pick up anywhere and is distributed by a whole host of different people. In terms of environmental health in general, I think it's also really important to consider the fact that we can leverage this moment to take advantage of other health-saving issues. So I mentioned that carbon monoxide is an issue in Canadian homes. I mentioned that humidity is an issue in Canadian homes. If people are riled up about cannabis right now, why don't we encourage them to put that CO detector in? If that means that we can actually get rid of some of the health risks that are happening already, that's a huge opportunity, right? We don't have to be just focused on the cannabis things to pay attention to the fact that this can actually help us in a whole host of other ways. I also want to point out that the work that we're doing is kind of now moving towards edibles, because that is definitely an issue in terms of food safety that we want to talk about in the coming years. So that's where our research is going to be. If you are interested in working on edibles, please do let me know. Can't move my slides, so, oh, there we go. So I was here, and we missed the last two slides, that's fine. I've put the link to this paper. If you actually are interested in an evidence review about personal cultivation in general, it's really short. I've shortened it so you don't have to write down the whole thing. There's a cannabis topic page on our website, which is basically just a collection of resources related to health and safety issues for different practitioners around cannabis. We are trying to cover this in a whole bunch of different ways, so we have a 2-page fact sheet about this that's really easy to distribute or talk to different people about. So that's part of what we are trying to do, is package this information in different ways for different types of people and what they need. I am going to leave the floor open for questions now, either from online or in the room. I'm happy to talk about other issues related to cannabis, if not personal cultivation, but go for it. Feel free. Thank you so much for having me here. Yeah, Karen. Oh, sorry. Okay. Oh, sure. Okay.
Just hold it.
Can I just hold it? Is that okay? All right. Yeah, Karen, go for it. Oh, there's another mic. Yeah, okay.
Thanks. Terrific. Thanks. And hi, nice to see
Hello.
you again. So I have two questions. Basically, the first question is, have you done an environmental scan of the likely places to put public health messaging, like where you buy your the lamps, and they're like all interesting and very varied kind of stores that people would be buying supplies at.
Sorry, do you want to ask your second question? Or
And the second question, is given that it's going to be a plethora and they will all be different, what is the messaging that you are giving for first responders?
So that's two great questions. The first question is related a little bit to the work that we do on the Federal, Provincial, Territorial Working Group on Cannabis Communication. So basically that means there's representatives from each of the provinces and territories that talk about the different campaigns that they're running. So those education campaigns are quite varied because unfortunately this subject is not the priority, right? It certainly hasn't made its way to the media in the same way that a conversation around impaired driving has, in terms of the conversation around access that youth might have. So most of the messaging has not touched this. Like, we're actually one of the only organizations that are at all interested in personal cultivation in Canada. And I think it's because the different provinces are developing such different rules. And so it's not consistent. Manitoba and Quebec have outright said no personal cultivation, period. And the Yukon has said, anywhere you want to grow, go for it. So the campaigns are very, very different in each of those regions. I don't think that this group has actually started to talk about distribution to stores. From my work on that committee, I actually haven't heard them once mention that they're going to reach out that way. I think they'll probably start at their cannabis retail locations. That tends to be where their brochures are going. It tends to be where there are educational professionals there to talk to people when they come in. And certainly they have a lot of material online at those cannabis stores. But this cannabis safety kit stuff has kind of been floated around at the municipal level rather than at the provincial regulation making level. So the Federation of Canadian Municipalities has published a big review on all the municipal issues that might be impacted. And so they're definitely tossing it around. But in terms of partnerships with stores, it's definitely not begun yet. It's just, which I think is a bit late to the party, frankly. But it's certainly something that is on the agenda. It just hasn't materialized into anything. And then the second question, can you remind me quickly? Sorry. Oh yeah, first responders. So they've been involved in the development of this project and have acted as reviewers for us, and we're constantly in contact with them to get feedback on what's happening and what they're encountering. I think it's the messaging in terms of making them aware of the obstacles that they will encounter in those emergency situations. So looking for fertilizers and pesticides, making sure they're aware that there could be butane lying around, paying attention to where dried material is. I think having an eye to the fact that those explosions can escalate quite quickly depending on what other materials are being stored. And because they've been involved in this project, that messaging has not needed to evolve much. It's like those risks are quite clear. So they are getting that back from us for sure.
Thank you very much. I'm interested in the health surveillance part of that. I'm curious, I don't know if this is an accurate characterization. It seemed like there isn't currently, or there's no historical information through our poison control or health surveillance, but I was curious about that. I know that legalization has happened, but historically people have been growing in their homes, and if you call in and you have to disclose. I just wonder if they've not been recording that it's been cannabis related, or has anybody looked historically at incidences in the data? Mm. Right.
When people call in, they're complaining about odor for the most part, or they're complaining about seeing it in their neighbors' backyards, right? And that's what's, you're right, historically been happening. But that data is not getting to the Poison Control Center, you're right. And so the data that they have is just about emergency issues.
What about the nurse line? Like the, whatever, what's that?
It's true. I think that's part of what I was talking about in terms of incorporating emergency room reports into this data that we have on poisonings, right? So at this point, nobody is required to report it to the Poison Control Center. So they're not required to report it to any criminal body either. It's just opioids, right? So when people come into the ER with cannabis poisonings or intoxications, that data goes nowhere. And that's something that I think we can build on. I don't think that that's something that's been done at all. I think Sorry, Mika, about my mic issues. Do you have any questions online? Oh, you have a question?
So, yeah, thanks for super interesting presentation and for agreeing to do it once again. I understand that you have been asked to talk about this topic quite a lot in the context of legalization here in Canada. So my question is really related to the occupational setting. And so, and I realize that this is growing at home, but you did make some comments about the protections of people who actually are handling these plants. So have you, is there anything that is going to happen in collaboration with WorkSafe BC? Do you see something happening in this like future, and in what context can you actually help them implement some procedures?
Yeah, that's a really great question. I think that what's important to note here is that a lot of the evidence that we have is coming out of those commercial settings, right? Because we haven't been able to get it from Canadian settings yet, because we can't use our taxpayer dollars to do that until now. So there has been a lot of effort in the States and a lot of oversight of those facilities, certainly. I don't think that they're necessarily paying attention to worker safety as much as they are to odor, because it's what the neighbors are complaining about, or to waste disposal, or to effluent, actually, from the facilities. So pesticides from a commercial facility, yes, do carry risks to the workers that are there, but it's the runoff that a lot of jurisdictions have also been concerned about. There's not as much issue around access and accidental poisoning for the workers, because they'd be poisoned by the solvents and the pesticides more than they would the plant, because they're not consuming it on the job, presumably. So it's a totally different ballgame. It's a different set of circumstances. That is an interesting point about WorkSafe BC. I think it certainly should be a part of the conversation. I think that because the commercial facilities are now just getting up and running to an immense scale, that's when it's going to start to be important, because, like I said, there's only been 67 licensed producers until now, and I suspect that will grow rather exponentially in the near future. But again, the risks that they're going to face in a commercial setting are not necessarily going to be exactly the same. The radiation stuff is a huge deal still, but the processing, for instance, is not going to be done in the same type of facilities, and they will have much greater safeguards. They're not going to be using their kitchen stove to blast butane down a tube, right? Like it's a much more intense process, which still carries risk, because obviously they're still blasting butane somewhere, but it's a very, very different process. So the oversight for that is well underway. I just don't know if they've been linked to worker safety organizations as much. I think it's more standards for their facilities in general, rather than focused on worker safety.
Again, thanks for a wonderful presentation. I do understand that some jurisdictions, especially in Europe, a country like in the Netherlands have actually legalized cannabis for quite some time. Do you think there probably could be some synergies we can build and some knowledge we can probably understand surrounding environmental health and occupational safety around this product?
That's a great question. I think in some ways, yes. In some ways, not so much, because there is a culture difference there in terms of the history of having those drugs be legalized that at the end of the day is more, what you're talking about is a little bit more about consumption because of the scale and size of those countries. Like at the end of the day, this is about being terrible gardeners, right? Like really, like legitimately, that's a bigger problem. What I'm talking about here are those risks at home. And some of those countries have not gone so far as to legalize growing at such a scale and over such a large geographic area. And I think a bigger problem is a consistency across the regions. So a place like the Netherlands has a much more consistent legal system around this because it's one legal system, right? Us having to actually collaborate and communicate and coordinate all of these risk messaging efforts, especially when the provinces are developing completely different guidelines and bylaws and regulations is tricky, and that's almost the trickier part because people don't actually know what they're allowed to do in their particular jurisdiction, whereas I think in some of those other countries it's quite clear and has been quite clear for some time. So the bigger stumbling block for us, I think, is actually informing people of what is legal and what is not. I don't think that many people actually understand what is legal to buy right now. I've spoken to many people who think that edibles are legal to buy right now and sell right now, which they're not. And seeds are legal to buy right now, but seedlings are not. And that varies in terms of where you're smoking it. That's like totally different across the country, which is a big problem. So I think figuring out a way to be consistent is going to be our bigger challenge, whereas in those countries, I think, because of the size of them, it's a very, very different ball game. And because those laws have been established for so long, it's not going to help us reduce necessarily these same types of risks because these risks are about getting the message out to the people. It's not about being aware of them, right? We know that these risks exist. It's helping people moderate those risks and reduce the harms that come out of them. Sorry, I wasn't talking into my mic. I apologize. Yeah, I know you guys can hear me, but it ruined my mic experience.
I actually have another question for you. So my question is to the real estate market. You know that before this whole movement started of thinking about legalizing cannabis, the homes were actually closed off if they were grow-ups, right? And there was this whole idea of like, how do you decontaminate the home? The sale price of the home went down if it was a grow-up, and so on and so forth. So do you also have any information that you can provide to public health inspectors, but also to real estate board in terms of like, how do we assess if a home has a certain level of contamination and what to do about that?
That's interesting because it kind of builds off of the issue of fentanyl remediation that we're having a particularly hard time dealing with here. It's a little bit different for cannabis because the contamination, like that might be just a really moldy house, right? Which is not a unique public health problem. It's certainly not unique for public health inspectors, right? So dealing with remediation for that is fairly straightforward and certainly doesn't have to be reported to a real estate board because it's not illegal to have mold in your house. It's just not great, right? So I think that that's a different issue than some of the issues with fentanyl because if you have a grain the size of a piece of salt of fentanyl, like that's a fatal hazard potentially, right? Which is not the case for cannabis at all. So that's one issue. In terms of commercial real estate, I think that actually has been a problem in terms of agricultural development. So actually even in Delta, a lot of the places that are growing food currently are switching over and have already been bought up by cannabis industry to have that commercial space to grow cannabis. So I think that's a bigger problem in terms of food security than it is about remediation or mitigation because there's only so much industrial space for people to grow things and there's only so much industrial facilities to process as well. So if that land and potential usable space for food is being used up for cannabis, that's a bigger concern in my mind if we have to push those food systems elsewhere. Yeah. Those are my thoughts. Oh yeah, I mean, and that plays into the odor issue that I mentioned for Leamington, like the Heinz factory that is now like just a cannabis town, right? It's about using up that space when it was used for something else, and now people are realizing it's much more profitable to use it for cannabis. Yeah. Would you like?
Thank you. Yeah, no, just to, instead of whispering on the side, just to say that the odor issue in terms of a multiplex situation, I think that's where the environmental health inspectors may have to deal with in terms of how, because it's more than just indoor now. It actually goes into the immediate environment outside of one's home. And so at the moment, there's actually a really good document out by Public Health Ontario addressing that issue, odor and cannabis cultivation. So in terms of real estate board, it's not a reportable thing, but I think that's going to come across also with other issues in terms of housing. So.
Yeah, just to add on to the real estate thing, different provinces are also giving landlords and tenants different rights on this issue, which is certainly going to be a problem with stratas as well. So some provinces are saying landlords have the absolute right to say you can or cannot grow cannabis. The problem with that, as I think we will find in Manitoba and Quebec where they've decided to ban it, is the number of legal battles that will ensue, right? If the federal government has decriminalized this and said, go for it, it's going to be very tricky, I think, in the courts in terms of landlord rights and tenant rights. So that's certainly something that's already been brought up. I'm fairly certain all those motions were filed on like legalization day, time zero, because it's actually like a concern across the country in terms of landlords having control over their properties.
Okay, well, please join me in thanking Leela for joining us today and presenting on a very timely topic. Thank you, Leela, and we hope to see you soon.